Hey, what's up? So this video is about my experience as a Med Surg nurse. So in my other videos, I posted that I'm like a jack of all trades. I've done a little bit of everything in nursing. I'm just one of those people that I have to try everything. I'm constantly looking for new ways to improve and just, you know, I always feel like there's something out there better. So I don't know if that's a good thing or if I'm just better off like doing one thing. I'm not sure. But so this video is about what it's like to be a med surg nurse by experience. If you're like a new nurse or you're a seasoned nurse and you're like just considering becoming a med surg nurse, maybe like you're like just ready for something new. My video is about being a new med surg nurse or just my experiences. So I personally did not like being a med surg nurse. Unlike other floors, I felt like it was constantly like an overflow floor. I don't know if it was just at the different hospitals I worked at or what. But I just felt like I was very, very busy. I had a lot of different patients to keep up with. And a lot of responsibilities. Looking at labs, dealing with families, just like running blood, hanging meds. I mean, it was just a lot. And sometimes I'd have 5 patients. I mean, I remember even having 6 patients. And if there's one patient that might not be doing so hot and they're consuming all your time, then I just felt like med surg was like really hard. It was difficult. And I remember having to stay over and chart a lot because you have to be sufficient in your charting. And if you have 5 different people to chart on, that's a lot. Also, if you like have 5 patients that are all blood sugars, like ACHS, you constantly have to be checking blood sugars. Some facilities, the aides will get your blood sugar like levels for you. Some facilities don't. So, you could be just running around like a chicken with your head cut off like all day long, which is not a problem. I don't mind that. Like, I'd rather just work while I'm at work than not work at all. But, I don't like to be overwhelmed. And this is just my experience. I'm not sure if like every hospital is like this. This is just what I've experienced. I've worked in med surg a few different hospitals. It was like kind of all the same thing, as opposed to other floors that had more like a specialty. So you'd have like the same things you'd see over and over. I didn't see that with med surg. I felt like it was like a little bit of everything, and it was just a lot to deal with. And then also, if you have 5 or 6 patients, be ready for a lot of discharges or admissions, which, you get, that might seem overwhelming to, like, a new nurse, but you get used to it, you get quick at it, but still, it's like, you're only one person. And if you don't have staff that backs you up and, like, helps you, like, prepare people for discharges, like, pack their rooms up or anything like that, it could be very difficult and daunting on the nurse. So, yeah, I've had a lot of experience with medical surgical nursing. It was too much for me. I didn't like it, as opposed to like the ICU. I felt like I can really tend to my patients' needs, or I only have 2 people. Sometimes I only have 1. So I can actually do what I love doing, which is like, really caring for my patients and taking care of their every need. Like, that I'm there to serve and I'm there to heal, and mind, body, spirit. Like, I really take my job serious. A little tip, if you are a new nurse, like I train a lot of nurses. So, and I always tell the younger ones or whoever, I don't know, I train older people too, I guess, so it's typically younger nurses that I'll train in like precept or whatever. So anyways, I always tell them when you're taking care of patients, you take care of them like they're your children. Like, you don't obviously talk to them like they're your children. Like, they're adults. You talk to them with respect. But, you know, if you're a mom and your kid has a dirty diaper, like, you take care of it. If you're a mom and your child is in dirty clothes, you change them. If your child is, you know, sitting in the same position too long, like, you tell them get up, move, or turn them, or whatever. Like, you just are their mom. And a lot of times when people are in the hospital and they're sick, or they feel hopeless, or they just got the crap kicked out of them from, you know, some crazy surgery, and they don't have any drive to move. Like, you are that voice that says, let's get you up, let's move you around, let's get you clean. Like, you know, just like you're their mom. And I don't know how many people have told me, thank you so much. Like, you have, you know, it almost makes you want to cry, you know, just because you're really making a difference in people's lives. And that's what nursing's all about. You know, you are there to change people's lives, and, you know, so it's not like any other profession. You are with these people when they're going through thick and thin, baby. Like, and you don't even know them. And guess what? Sometimes you're the only voice that they have to encourage them to keep going. And so that's why, you know, you always want to care for your patients as if you're their mother. And just love on them, and I promise you, you'll never have complaints. And people will really appreciate it, and that's how you show love to people, not by words, but by action. Anyway, so that's my advice on medical surgical. I think it's a great learning experience. I mean, you're going to learn everything. You're going to get your skills up. You're going to be constantly placing catheters, taking them out, learning different labs, different conditions. I mean, I did it for a long time, and I don't regret it by all means. It was a great learning experience, but that's the reason I left, was I just felt like it was too many people to really look after. And I think other people might be good at that. Me personally, it's just like, you know, not really my cup of tea. So, yeah, that's my experience with medical surgical. If you have an opportunity, you're new, I think about it. Definitely take it if you don't really have a lot of experience, because you can learn so much. Okay, sorry about that. So anyways, yeah, I think Med Surgical is really good. You'll learn a lot. You'll meet a lot of big people. You'll get really good at discharging. You'll get really good at admissions. There's going to be some days that you cry or scream or whatever in private, I mean. But for what it's worth, it's really a good learning experience, and it's definitely a good skill if you want to maybe travel in the future. Like, there's always a lot of contracts for medical surgical, and it's pretty, like, universal. Just want to chart on, like, your eyes and nose, and you look at your labs, pass the medicine, take care of all the patient's needs, address anything to the doctors that you see, make sure that you're monitoring wounds and that kind of stuff. And obviously there's way more that you can, the things that we do are like endless. But yeah, so alright, thanks for watching, and you know, like and subscribe. This will be my new channel. I'm gonna just put up videos with my experience, maybe do some like teaching videos, if there's like whatever the demand's for. I just would love to share my knowledge and stuff, and just have something fun to do on the side. So I hope you like it, and yeah, God bless. And before I let you go, I wanted to add one more thing. I just made a video about travel contracts, travel nursing, maybe a little bit, talk about a little bit of like all the different specialties that I've done. So check that video out, especially if you're thinking about traveling in 2020. A lot of things have changed since the pandemic has started, and so there's so many more factors to consider. If you are like considering traveling, just check it out. Like and subscribe. So That way you can follow me for more tips on nursing and whatnot. Okay, thanks so much. Have a good one. Bye.